At DPV Health, you are at the centre of everything we do. Your health and well-being are our highest priority. We're here to guide you and your health with expertise and experience. With more than 20 locations across Melbourne's north, have your say in your healthcare.
My health.
My health.
My health.
Choose the services you need, the way you access your consultations, and the language you are most comfortable with. At DPV Health, we are an inclusive, not-for-profit organisation celebrating the diversity of all people. You will feel respected, safe and welcome, and you will receive excellent care in state-of-the-art facilities from professional, supportive clinicians and staff. Because you are unique, and so is your health. Our promise to you is
Your healthcare, your way.
Your healthcare, your way.
Your healthcare, your way.
DPV Health. Your healthcare, your way.
All right, everyone, we might make a start now. Again, a big warm welcome. I'd like to especially acknowledge all of our community engagement framework participants who are attending. I'd like to officially begin tonight by acknowledging our First Nations people as traditional custodians and owners of the lands and waters on which we're meeting today, and pay my deep respects to their elders past, present and emerging, and any that may be with us tonight. With tonight, we ask that everyone that you do keep yourself on mute unless you're actually speaking. When we get to the questions, you'll be able to post your questions in the chat or raise your hands. So I'm Don Tidbury, I'm the CEO for DPV Health. DPV Health is Northern Melbourne's largest and most comprehensive community-based organisation. We provide an extensive range of services including COVID testing, vaccinations and respiratory programs. We have medical clinics, dental services, mental health, allied health, children's programs, extensive range of children's and adults' disability, family violence, homelessness, refugees, and many other programs to support you to live a healthy and happy life. I would like to welcome our special guest tonight, Dr. Christian McGrath, Infectious Diseases Physician from the North East Public Health Unit, Dr. Don Campbell, Divisional Director, Hospital Without Walls Program, Northern Health, and Jane Campbell, Chief Operations Officer for DPV Health. So tonight's session is intended to support you and your family to get through this winter for COVID, colds and flus. That's to support you all to reduce the likelihood of you catching these viruses and also support you and your family in the event that you do catch them. In terms of supporting people who and languages other than English, we have our multicultural co-facilitators on the screen who will be distributing this information to their communities after tonight's session. The session is being recorded and that will be distributed, and a special information document with the key insights and messages from tonight's forum will be posted on DPV Health's website tomorrow, and that information document can then be translated to other languages using the translation toggle on our website. So how tonight's going to run is I'm shortly going to hand over to our guest speakers. We've got about roughly 30 to 35 minutes of content to work through, and then we will have plenty of time for questions and answers at the end. So we ask if you can hold off on the questions and answers until we get to the around the 6:10 mark. Although if it's a really great question, you're welcome to post it in the chat. But there will be plenty of time for questions I said, this session is being recorded and we look forward to distributing the session through our website tomorrow as well. So what I'm going to do now, I'm going to hand over to Dr. Christian McGrath, Infectious Diseases Physician and Clinical Lead at the North East Melbourne Public Health Unit, to make a presentation. Over to you, Christian.
Thanks, Don. So I'm just going to speak to everyone today a little bit about the common cold, flu and COVID, why we see a little bit more of that in winter, how it spreads, and therefore how we can protect ourselves, including that a little bit of a discussion around vaccines, and then hand over to Don Campbell from one of my colleagues at the Northern, who's going to talk a bit about early therapies and services available to support people with COVID. I just want to briefly introduce NEPHU, which is the North East Public Health Unit. So it mightn't have been obvious to everyone, but in 2020, public health was decentralised in Victoria, and a North Eastern Public Health Unit was created, which covers a very broad area of the northeast of Melbourne. And we have sites based at the Austin, Northern and Eastern Health and cover a population of about 1.6 to 1.8 million people. I am based at the Northern as the clinical lead, and while we've been predominantly managing COVID in the recent past, we're hoping to start spreading into other areas of health promotion and health prevention to try and really improve public health across the community in our local hood. We're staffed by people from our area, so hopefully that will see real benefits in the future. So we'll just get to the next slide. So as I said, just going to talk a bit about colds, how they spread, who's at risk, and how we can keep everyone safe. So next slide. So what is a cold? And I think, I'm not going to presume anyone's knowledge on this, so I'm sorry if it's a bit basic, or I'm sorry if it's a bit complicated, but I think it's important to realise that a cold, as we know it, the common cold, isn't just from being out in the cold. And I think some people think that it's an old wives' tale that sort of persists. Most colds are caused by viruses, and I've listed off some of the viruses that are present in that list there. And you might recognise some of the names, such as coronaviruses these days, of which COVID-19 is one of the coronaviruses, but it's only one of about 7 that infect humans. And you'll see influenza viruses there. At the top of that list is rhinoviruses, which is the most common cause of the cold. And really what happens is the virus, which is basically like a little bit of genetic material with a shell around it, basically gets into the nose or the pharynx or the larynx, which is basically the throat, or what we call the upper respiratory tract. And that virus invades the cells there, sets up shop, starts replicating and causing infection, and spreads to other people from there, which I'll talk about in a moment. Sometimes more serious infections, they get into what we call the lower respiratory tract, which is mostly the lungs, and cause severe pneumonia, which can make you much, much sicker. So the next slide. And they're very hard to tell apart, to be honest, although there are some patterns and themes. So if you have a look at this table here, for example, this lists some of the symptoms you might see in COVID-19, some of the symptoms you might see in flu and the common cold. And you can see things like fever and chills are very common in both COVID-19 and influenza, but not so common in the common cold, which is usually less severe. But you might see that things like sore throat and a cough are common across all of them. So that's why it can be hard to tell the difference. And sometimes the only way to tell is to get a test, basically. The flu is generally worse than the cold, and COVID for a lot of people is worse than the flu, although vaccines gone some way into helping improve things from that point of view. It's important to note that seasonal allergies sometimes cause similar symptoms as well, which can make it really difficult to tell the difference between the two. But people tend to feel much sicker with COVID-19 or influenza than just the common cold. The next slide. So why do some people from these viruses get sick and others not? The main reason is basically that not all viruses are equal, but not all people's immune responses to viruses are equal. So it can depend on the person's immune response to the virus. So if a lot of our symptoms, like the fevers and the chills, is actually the immune response, and the immune response is basically the police system of the body that's really trying to protect us from unwelcome invaders. Its response is really to get rid of that virus and take care of it. And the person's immune response will work better if they've been vaccinated and have had a vaccine and seen the virus before, because they'll recognise it sooner. where it may work worse if their immune system doesn't work so well. And that may be from some other types of diseases or other immune altering drugs. And sometimes it's just bad luck. Our genetics are all different. We're all different. And that means sometimes we respond differently to when we're infected by a virus. The type of virus or the strain can sometimes influence how serious it is. And some of you are probably aware of that because we've talked about lots of different strains of COVID. And you've probably heard about the Delta virus, for example, and the Omicron strain. And those different strains can predict how unwell we get. With COVID, we know that one of the biggest risk factors to very severe illness is advancing age. And it's a very, very straight line. The older you get, the more at risk you are of consequences from COVID, unfortunately. And that's true that you're at risk of serious complications from COVID if you've got other medical problems such as heart disease, diabetes, if you're a smoker or have lung disease, or obesity, or a weakened immune system from other causes. With flu, it's quite similar, list of issues and problems. The relationship with age is less strong, but still present. And certainly if you're at the extremes of age, young or old, you're at risk of severe flu. And pregnancy is also seen to be a risk factor for flu. Next slide. Importantly, how does it spread? So I was saying at the start that what happens is this virus gets into the cells at the top of your respiratory tract, so into the nose, the back of your throat. And what happens is it replicates there, and then it spreads through the droplets from there. So if we cough or if we talk, and there's a very graphic picture there just showing someone sneezing, you can see those droplets which have cells and virus in them just spreading from person to person in that sort of way. So the way to think about it is these drops basically come out as I'm talking and they fall to the ground. And how far that falls depends on how big the drops are and gravity's influence. But usually most drops in that fall to the ground within about 1.5 meters, which is why you've heard that magical distance mentioned in the last few years with physical distancing to try and reduce your risk from droplet spread of COVID. Now, flu and cold and COVID most of the time spread that way through the droplets. But occasionally COVID can act like airborne spread. And airborne means basically, if you can imagine someone breathing smoke out, over time, the room, if you're just sitting in it, will start to fill with smoke, and the virus will start to just spread and fill the room with virus. Basically, that smoke or that mist will fill the room, and that's why we talk about airborne spread and the importance of ventilation, which I'll touch on in a moment. The other way these viruses can sometimes spread is these droplets. They can land on on surfaces like handrails or tables or chairs, surfaces like that, which you can then pick up, and then touch your own mouth or eyes, and this infection might spread into your body that way, and we call them fomites. So why in winter do we see more spread, basically? It's a good question. There is some evidence to suggest with most of these viruses, but not all, that temperature and humidity can play a role in how well the virus survive, both in the air, on surfaces, but really the biggest factor is human behaviour. And in winter, people tend to want to huddle inside together rather than be out in the cold, and therefore they're all closer together. So the risk of getting those droplets touching you or that airborne infection spreading between you just goes up. And that's why sometimes in some parts of the world, like around the equator, we see what are called tropical colds, for example, because people want to hide inside from the heat and the humidity in that space. So basically, that's why we see these seasonal variations in infections, and we see increased colds and increased flus during winter. With COVID, for example, those little variations like the temperature, the humidity, and the human behaviour, they're relatively small contributors to how much infection we're seeing spreading. So the seasonal variation is less of a deal. We just see COVID all year round at the moment. And that's because lots of people are picking it up, because lots of people are vulnerable to getting COVID because it's a new virus. Next slide. So I just want to briefly touch on this thing called reproduction rates, which I think some people are familiar with now, but I don't want to overcomplicate it. But really what an R value means, which is what we talk about when we talk about how much an infection spreads, is just how many people one person with the infection will give it to. So an R of 2 means one person with an infection with an R of 2 will give it to 2 people, and then that person will give it to 2 people and 2 people and so on. You can see from the picture on the right that growth can mean lots of people get infected very, very rapidly from those changes in the R, and that any changes to the R can make a big difference to how quickly an infection spreads. So in an average year of flu, the R value, or the R naught as we call it, is 1.2 to 1.3. That means one person will give it to 1.2 other people. So it spreads, but it's relatively slowly spreading. I want to compare that to Omicron variant, which we think the R0 value under normal circumstances is 8 to 9. So you can imagine if one person gives it to 8 to 9 other people, who then gives it to 8 or 9 other people, that growth is very rapid, and that's why so many people get the infection so quickly. In Victoria at the start of the year, because of all the measures we had in place, like recommendations of physical distancing, the masks, and really the widespread vaccination, we were able to drop that to 3 or 4. So we were able to halve it, which makes a huge difference. If you can imagine, every time that spreads to another person, they're spreading it to half the number of people they were before. So any changes to those R0 values make a big difference in the spread, and that's called the R effective value. Next slide. So how do I keep myself and others safe? So really, one of the key ways is to reduce transmission. And vaccination has a role to play in that. Predominantly, we recommend vaccine about protecting yourself from death or severe disease, and I'll talk a bit about that in a second. But vaccination also has a role to play in reducing the spread and helping keep others safe. And even if it's only 50% effective, you can see how big of a difference that makes. If we've got a virus that spreads to 8 or 9 people, dropping that to 3 or 4, other people getting infected, and replicating that every time someone gets infected really slows down how fast it spreads. And if you think back to the start of the COVID pandemic, when we're talking about flattening the curve, that's one of the main aims from doing that type of thing. Physical distancing, that 1.5 meters from others to stop the droplets from spreading from your nose and throat to someone else's nose and throat, makes a difference. And wearing a mask helps protect yourself and others. If you're wearing a mask and another person's wearing a mask, that really helps to reduce that risk of those droplets spreading from person to person, as does washing your hands to try and prevent picking it up from those surfaces or those fomites. And then I talk about indoor ventilation. So if you can imagine you're sitting there breathing in and out and filling a room with smoke, if the doors and windows are open, just like you need to do sometimes if you burn the toast, which is not an infrequent occurrence to me, and the smoke alarm goes off, opening the doors and windows helps air change over in that room. The smoke goes out and reduces the risk basically of the infection spreading that way. So one of the problems during winter is that no one wants to do that because it gets cold. So other things you can do is fans to help circulate air. If you've got air conditioners or ventilation systems that bring in air from outside, that can make a difference. And some people choose to use air purifiers or air scrubbers, which help to draw air through them and cleanse it, filter out the virus and into the fresh air. And often a HEPA filter is the best one to use in that sort of environment. Some people choose to minimise their contact with others, and that means, they don't want to leave the house so frequently. And I guess that's up to an individual assessment by every individual, the risk and benefits of doing it. For some people, because say they've just had chemotherapy and their immune system's being turned off, they might choose not to leave the house much for the 2 weeks following because they don't want to risk getting COVID while they've got no immune system, and that's fair for them. There might be other young people out there, for example, who are fit and healthy and unlikely to suffer severe consequences of COVID, where the idea of not being able to go out to the pub every Friday night is a big deal for them, so they will choose to go out. And it's important everyone has to think about how they modify their behaviours in terms of reducing their risk of COVID. Certainly avoiding crowds when there's a lot of COVID around in the community or lots of flu and other colds is probably not an unreasonable thing to do. And if you do have to be out in crowds, then wearing a mask is important. I talk about indoor ventilation versus outdoor ventilation. The good thing about being outdoors is that airborne risk really goes down. It becomes much, much less, because you can imagine it's hard to fill up a large space outside with your own breath. It just spreads out throughout a large environment, reduces the risk of spread outdoors. I think the key things to think about are if you've got symptoms of any type, and I sort of showed that slide how hard it is to tell the difference between cold and flu and COVID, but if you have any of those symptoms like cold, symptoms or runny nose, sore throat, fever and chills, stay home. Don't go out and give it to anyone else, basically, irrespective of what it is. And if you've got risk factors, which I'll talk about in a moment, for severe disease, as we touched a bit on before, to test and get a treatment, which Don's going to touch on in a moment. None of those factors that I've just talked about to reduce transmission alone are the B's ends. They don't work completely effectively, but if we add them all up together, they all start to make a difference to reducing the risk of the infection spreading or you becoming infected or the people you care about getting infected. Next slide. So this is a reasonably complicated slide. I apologise for that, but I just want to show, if you look at the picture on the right, why it's important with the importance of a third dose vaccine for COVID in the times of Omicron. And you can see the red line at the bottom is Omicron for hospitalisation risk, and the green line is Delta. So if you had a second dose of vaccine you were 96% protected. That's the green first dot from Delta, and 86% vaccinated or protected from Omicron, which is not bad. But what we saw is after 6 months, and that's what the waned line means, people's immunity to Omicron really started to drop off as opposed to, say, Delta. And it dropped from 86 to 67% protection, where it remained higher at 90% for Delta. The good news is if you got boosted with a third dose of those vaccines, your immunity went back up to the 90% mark from hospitalisation with a third dose against Omicron. So that third dose for Omicron is really important. And local data, this data came out of the UK, but local data from Victoria showed that a third dose of vaccine reduced your chances of death by 76% compared to having only 1 or 0 doses of vaccine. So it is still it's a very effective vaccine to get to protect yourself from death or hospitalisation with that booster, which is why we're all keen for as many people as possible to get the booster dose to protect themselves. Next slide. I just wanted to highlight the COVID rates and influenza rates. Vaccine criteria in Victoria at the moment. It's important to note that you can have the COVID booster shots or COVID shots and the influenza shot together at the same time. The immune system's clever and can deal with both at the same time, so that's not a problem. You can see here that anyone over 16 years of age, where it's been more than 3 months since the second dose, are eligible for the third dose of COVID, the booster dose right now. Anyone who's at risk, who's got risk factors for severe disease of COVID, are eligible for a fourth dose, or what we call a winter dose of COVID. So that means if you're over 65 years of age, or if you're an Aboriginal or Torres Strait Islander over the age of 50 years of age, or if you're immunocompromised, so you've got medications on board, or if you've got an illness that puts you at risk of severe COVID. And that might include cancer, lung disease, diabetes, for which you're on medical therapy or treatments or drugs, heart disease, kidney disease, or obesity, then you're eligible for a fourth dose. So please talk to your GP about getting a fourth dose. And if you haven't had your third dose, definitely get that on board. Influenza dose, that's been free to everyone for the month of June, noting that there's only 1 day of June left tomorrow. So if you haven't had your dose of vaccine for free from a pharmacy or GP, get out tomorrow and get that done. But otherwise, at any time of year or any time throughout winter, if you're aged over 65, if you're an Aboriginal Torres Strait Islander of any age, a pregnant woman, immunocompromised, or have any of those other medical conditions that I've again listed, you're eligible for a free flu vaccine at any time. So please go and get it. And anyone else can still get a flu vaccine, and is recommended, given it's going to be a big flu season, but it may not be free for you, although you might be able to get it through your employer. But still consider the flu vaccine if you haven't got one of those risk factors to help protect yourself and others. Next slide. Just before I touch on that, I might just point out that in human literacy, we have got pretty low third dose vaccines for COVID. I think the third dose rates for adults in human literacy is sitting around 52 to 55%, which is lower than the state average of around 65%. So I would really encourage you to get out there and, if you haven't had the third dose, to go and encourage your friends and colleagues to consider getting a third dose to keep themselves protected and to keep those around them protected. And I'll just point out that human LGA and the Whittlesea LGA have been the 8th and 5th hardest hit LGAs in Victoria by influenza so far in terms of reported cases. So we are still seeing a lot of flu in our region as well. So please get along and get the flu vaccine. I said it's hitting our area quite a lot. I think this year about 37% of the population in Victoria have had the flu vaccine, which is a great effort compared to previous years. But given the severity of the flu season this year, it's important to consider getting the flu vax if you're eligible or got risk factors. I just want to touch briefly on how else to keep well in winter. And I think it's really hard when the days are short, when it's cold and miserable outside, to keep up with regular exercise and sleep. So it's important to keep an eye on those things, that you are getting enough sleep and you are getting enough exercise, and keeping a balanced diet and not using alcohol to cope with the horrible weather. For some people, hydration and moisturizers are important, because being indoor in heated environments can really dry out your skin and make you uncomfortable. And all those things can combine to make your mental health less than ideal, and we do see seasonal mood swings. So make sure you acknowledge that, pay attention to the fact that your mood might be a little bit lower, and make sure you make time for friends and fun, and be kind to yourself. Make sure that you talk to someone like Lifeline or Beyond Blue if you need to. And just finally, if you are a smoker, good a time as any to think about quitting because of those damage to the lungs and the increased risk to getting all of those infections that I've just touched on. Next slide. So I think this was handing over to Don to talk about managing the illness. Thank you.
Thank you very much, Christian. And thank you to our friends at DPV for the opportunity to join you this evening. I'm going to talk a little bit about responding to COVID. But to start with, I would just like to emphasise the message about vaccination for influenza. I'm reminded of this because one, I've had influenza, and if anyone ever says to you, "Oh, I just had I had the flu," unless they go on to tell you in great detail how dreadful they felt, they didn't have the flu. When I was a great deal younger, one of my colleagues with whom I worked contracted influenza. He was the father of 2 young children, and was a medical colleague, and he sadly passed away at the age of 36, and that was 38 years ago, so he would have lived to an advanced age, we would have hoped, but influenza can affect people of any age, so it's not to be trifled with, and the vaccine is free and provides a great deal of protection against severe illness as a consequence of infection. Now to talk about COVID. Well, the first responsibility is that if you have symptoms suggesting that you might have COVID, to get yourself tested and to isolate. Now, it's problematic how you'll get access to a RAT test if you're required to isolate at the same time, but you are advised to get a RAT test and to register the results. And you can register it on the phone or on the website. And that helps us to help look after you. There are available, of course, symptom relief measures that you would use to relieve symptoms consistent with a cough or a cold, in addition to medications to relieve fever and muscular aches and pains of the Panadol variety and others. You will need to pay attention to fluids. We have seen people affected by gastrointestinal symptoms and the fact that they don't want to eat or drink and they get dried out. So you are going to need to keep the fluids up, and the way you do that is making sure that you're frankly having a pee every 6 hours or so, so that you can at least keep track of your fluid intake and whether you're getting enough fluids. I'm going to talk a little bit about the medications that are available as early therapies. The first one, and I think we'll go to the next slide, I'm going to talk about the antivirals and the antibody treatments and eligibility, but the first one is a steroid inhaler. And this is a stock standard asthma therapy. It is available on prescription, and when used, 1 puff twice a day of the 400 strength Pulmicort, that reduces the risk of deterioration and hospitalisation. It's targeted to those with risk factors for deterioration with significant symptoms. And at Northern Health, we've dispensed since October last year 3,500 of these to people who've met the criteria. These inclusion criteria include age over 65 or over 50 with 1 or more of the following: diabetes, heart disease, asthma or lung disease, a weakened immune system due to either serious illness that suppresses your immune system or medication for another condition that might suppress your immune system. For example, chemotherapy for cancer. In addition, people who've got liver disease or have had a stroke were included in the trials. And this inhaled steroid is safe. You've got to rinse your mouth out. You've got to get it on prescription, but you use it for 7 to 10 days and it will reduce the risk of deterioration. And we've used it freely. If you've already got asthma and you're already on this treatment, then you would be advised to consult your doctor and to increase the dose just for that limited period of time. The next slide, please. Now this slide I'm going to talk about the early therapies that we've now got available. And there are 3 of them so far. And these are used for people who are at the highest risk of severe COVID. And it's been shown that early treatment reduces the risk of hospitalisation by 60 to 70%. So there's about a 2/3 reduction in your risk of being admitted to hospital, and the risk of being admitted goes up as a function of age, of the presence of these comorbidities, what we talk about, the diabetes, heart disease, lung disease, the weakened immune system or cancer. These are the things that increase your risk of being hospitalised. And these are the people with these conditions are the ones that we think will benefit the most from these treatments. I'll just see now, I think we could look at the next slide, and I'll go through the 3 treatments that we've currently got available. In Australia, these treatments are available at no charge to the persons who qualify for them. And what we do is we've got 2 oral treatments and 1 intravenous treatment. And I'll try to talk about them in the order that they're here on the slide. And I've got some cheat notes that I'm looking at as I'm talking to you. The first one's they've all got strange names. Paxlovid is a combination of 2 tablets in a blister pack. And people are eligible for this if they meet the criteria of being symptomatic, being either unvaccinated or immunocompromised regardless of vaccination status, or who are not up to date with vaccination and who have these multiple risk factors, or they're over 65. So they've got to meet criteria, and then if they're eligible, they'll be prescribed this course of treatment, and we'll talk about how you can get access to the treatment through either the hospital or your general practitioner or the GP respiratory clinic. As my kids would put it, it's a little bit tricky because you have to be careful about interactions with other medications. You have to be careful if a person has impaired kidney function, and it's not possible to prescribe this drug for pregnant or breastfeeding women. So we don't know whether it's safe or not, and we're not prepared to find out by giving it to pregnant or breastfeeding women. So that one's out. If you're pregnant, breastfeeding, there would be dose adjustment if you have kidney trouble, or it will be excluded if you're on dialysis. And we've got to be very careful about interactions with other medications for a variety of reasons. The next one is called remdesivir, and remdesivir is given as a infusion into the vein, and it's given as a infusion in hospital on the first day, takes an hour, and then in the second and third days the dose is repeated, but it's safe to administer it at home. Currently we are able to prescribe and supply this from the hospital, but not from general practice. The symptom window is a bit longer with remdesivir. And in terms of its usefulness, again, those same criteria apply. Immunocompromised, regardless of vaccination status, at-risk unvaccinated individuals, the over 65s, and those with chronic disease, whether or not they're up to date with their vaccination. So it's an individualised decision, and we're not sure how long we'll be able to supply this for. And I can't for the life of me remember, it's not routinely used in children or adolescents, and I can't quite see, here we go. It is open for use in pregnant women who have these risk factors. The final treatment is a tablet, and this is molnupiravir, and molnupiravir is a 5-day course of capsules, 4 capsules twice a day. These things are about the size of horse pills, so they're not easy to swallow, and there are some questions around the use of molnupiravir in pregnant women because we do not have any data on their use in pregnant women, but in animal studies there are questions about the effects on fetal growth. So they are really, it's problematic how you would use this unless you were, I think there are too many questions about its use in pregnancy or sexually active women. So that's those 3 tablets, and there's a GP helpline, and the number is, sorry, yes, that's on that slide. There's a GP helpline because we have found it very helpful to have access to a pharmacist who is full bottle on this. And so there's a GP helpline for GPs to get assistance with prescribing and making sure they get it right. Next slide, please. So we've talked a little bit about making an assessment, and that's why it's important to register if it comes through to us, and to contact your GP. And some GPs are really very keen on getting involved in access to early therapy, and for some it's a bit more difficult. And there are, of course, the GP respiratory clinics, and I know that DPV has 2 of these, and I'm sure that you'll be told a little bit more about that after I finish speaking. So there's an assessment about the vaccination status, the presence of comorbidities and risk factors, as well as age as criteria for these therapies. Now, the next slide, I think, is my last slide. When it comes to seeking medical care, if you've got symptoms you are worried about, you can contact your GP. If you're on a hospital-based program, you can check in with that program. I won't go into the details of how that works. You can check in with your GP respiratory clinic, and there is a thing called the Victorian Virtual Emergency Department. And this is available on, there's a website, you search for it, you find it, you contact them, and this is for healthcare practitioners, GPs, and also for members of the public across Victoria. It is a first, and it has been developed at Northern Health by our emergency department. The Department of Health has seen the wisdom of this service and has made it available across Victoria. And I think it's something, I know I'm proud of it, I know Christian's proud of it, and I know that we can all be proud of it, and they're doing a great job. I think that's it for me, and I'm going to hand back to our colleagues at DPV. So over to you, Don Tidbury.
I'd like to, thanks Don and Christian, they were very informative presentations. I'd now like to throw to Jane Canaway, our Chief Operations Officer at DPV Health.
Thanks very much, Don. Thanks everybody. I just wanted to quickly mention to you about our respiratory clinics. So as Dr. Campbell mentioned, we have 2 respiratory clinics, one at our Broadmeadows GP site and one at our Mill Park GP site. These clinics are set up to support people with COVID-like or cold and flu-like symptoms. So we're talking about things like a temperature or fever, sore throat, blocked runny nose, coughing, wheezing, and even perhaps a bit more severe symptoms like shortness of breath or chest pain on coughing. Particularly these clinics are staffed by nurses and doctors who have expertise in working with people who might have underlying issues with their respiratory system, such as asthma or chronic obstructive airways disease. And so what happens is when you attend the clinic, you're seen by a nurse and a doctor. They'll undertake a full assessment and see how you're managing your symptoms and see how unwell you are, and then provide treatment such as ordering additional tests, such as a COVID test if you've got COVID symptoms, possibly referring you for somewhere else for additional care if you need specialist care, if they're really worried about you, the hospital, or prescribing medications such as the one that Dr. Campbell just spoke about. In order to prescribe the medications, they need to get a full idea of your medical history. So if you can bring along any of that sort of information or know that information when you attend, that's really useful. Next slide, please, Ryan. So just a few questions about the logistics of the clinic. So who's eligible? Everybody's eligible. If you have a Medicare card, it's best to bring it along, but if you don't, that's fine as well. They're free and they're open extended hours. So they're open 10 till 7:30, Monday to Friday, and then 10 to 5:30 on the weekends. Booking, you can book online through our website there, dpvhealth.org.au, or you can call the number. We also accept people who just turn up, but we do ask if you can do that to ring first, just so you'll know how busy we are, how long you might have to wait. When you get there, we get you to stay in your car. You let us know you're there. You get you to stay in your car until you come in to see the nurse and doctor, because we're all trying to work in a safe COVID way. So we're all trying to avoid clients mixing with each other, I guess. So there's the address, and that's the end of it. So I'll hand back to Don and see if they've got any questions. Thank you.
Thank you, Jane. And everyone, we've been through quite a bit of information tonight, and I'm sure that's generated some questions for you. You are welcome to put your hand up, or you can pose your question into the chat. We would love to hear from you. All questions are valid and relevant. If you're thinking it, I'm sure someone else is thinking it too. So we'd love to hear from you and what questions we got today. What questions you got today? So we've got a question here from Nilam. Welcome, Nilam. And Nilam's asking in the chat, if someone does not have any complications, do they still have to get the 4th dose in the next year? Would the effectiveness of the 3rd dose diminish over time? So on that question, I might throw to you, Christian, in the first instance.
Thanks, Don. Thanks for the question. So the 4th dose, it's a good question. And I've been asked to use my crystal ball to predict the future a lot in the last couple of years. Unfortunately, it still fails me. In short, I expect the answer is yes. I'm just not sure about when. So there's some evidence to suggest that immunity does wane in most individuals over time, even after the 3rd dose. And certainly there's some evidence that's come out of the US that suggests that a 4th dose in those over age 50 is justifiable. At the moment, the data in Australia has shown that really the real bang for buck for that 4th dose has been in the over 65 group to prevent hospitalisations. It's almost flat, then boom, starts to go up after a while. If you're over the age of 65 and you haven't had a 4th dose, your risk of hospitalisation. And that's why up until recently it was targeted in the over 65 group, and then it's been extended to include all these other immunocompromised groups. I suspect that there's going to be a group of people such as healthcare workers who were vaccinated towards the end of 2021, where immunity might be starting to wane, and there might be inclusion in a 4th dose, and people over age 50 be included in a 4th dose in the near future. When I say the near future, I mean probably in coming months. But that 4th dose for everyone, I suspect, will still happen at some time in the next 6 to 12 months, depending on what the evidence shows. Because remember, COVID's not that old, so we're sort of learning as we go. But also there's a bit of a hedging of bets because there's a few new vaccines in development, including some that might be a bit more Omicron specific. So it's always a bit of a gamble. Like, do we wait a little bit longer and see if we can get an Omicron specific or slightly improved vaccine, or do we go ahead with the current dosing, which we know is still quite effective at preventing severe disease and death, but we know people are getting sick of vaccines. So it's a bit of a waiting game and trying to balance all those sort of factors. The reality is we've only sort of 52 to 55% of the Hugh Whittlesey area having had the 3rd dose. We've still got a bit of a task ahead of us to try and get the the broader population to get a third dose. So we've really got to encourage that. But it's really great to see that there's some people keen and enthusiastic to get that fourth dose to increase their protection.
Thank you, Christian. And there's another, I think, really pertinent question in the chat from Anisha. Welcome, Anisha. And Anisha's asking, my kids are vaccinated for flu, but still get colds and flus. What's the point of having flu shots? And that might be yours again, Christian, that one.
Yeah, so again, good question. The main thing, the benefit is it reduces the severity of illness, basically. And that's definitely true of COVID. So you probably know from the COVID vaccine, people have said, but it doesn't stop me from getting infected. It does reduce your risk of infected, but it doesn't stop you from getting infected. But it certainly reduces your risk of severe disease, hospitalisation or death. And it's the same with the flu shot. And the reason being, as I said, when your body gets the virus land on your the cells in your airways, basically it takes a few days for your immune system to kick in and recognise that this thing shouldn't be here. The police is to go and basically say go away and fight it off. So if you've had a flu shot and the flu shot vaccine, basically what it does, it's like putting up a wanted sign for that virus, so the immune system recognises it straight away and gets in there and attacks it before it starts to get a chance to really set up shop and cause more damage. So while you might still pick up the odd colds and flus despite the vaccine, if you do get flu, and it's important to note the vaccine will only protect against the flu, not against the rest of the colds that you might be exposed to. And it's a flu, as Don said a little earlier, that can cause really severe illness, and that's why there's a vaccine against it. That's the one we want to stop you from getting, and that's the one we want to stop you from getting severe disease, and that's why the vaccine's important.
Thank you, Christian. Now, we've got a few more questions coming through. I'm actually going to go to the hands up now. Now, Jamal, you had your hand up first. We'd love to hear from you tonight. We've still got Jamal there. Just turn your camera on and put yourself off mute. Looks like Jamal might have stepped away for a second. So I'm going to throw to the wonderful Tammy Connolly. Welcome, Tammy. We'd love to hear your question tonight.
Thank you, the wonderful Don Tidbury, my former CEO at DPV Health. I'm very privileged and I forgive my counterparts at Northern Health. I work at Epworth, having worked for a period of time at DPV Health very proudly, and I can't implore enough the need for getting your COVID vaccinations and your flu vaccinations. I'm in touch constantly with our directors in ICU here, and if there's one message that I'd like to leave everybody with in support of this fantastic presentation, it's to please ensure that you do keep your boosters up and you do get your flu shots, because it's the best way to protect yourself and your family and friends from getting into hospital. So I just wanted to reinforce that message. And look, DPV Health as well, to be able to provide those vaccinations has been sensational. So, thank you, Christian and Don Tidbury as well. Can't implore enough. So I hope lots of people watch this presentation.
Well, thank you for those kind words of support, Tammy. Now I'm going to throw to in the chat. We've got two great questions which overlap. So we've got a great one from Dalal from our community engagement framework. Which age of people are more at risk of getting flu? Many people are reluctant to get flu, thinking they get flu after getting the vaccine. So they get a cold, they're getting the vaccine. And then just tying that to Tara's question, what is the best time to get your flu vaccine? So now, Don, did you want to have a go at that one, or Christian? Who would like to answer those two questions?
Thanks. Look, I'll tell you when I get my flu vaccine every year, and you need a reminder, and I use Anzac Day. When Anzac Day comes round, it's time to get a flu vaccine. And that's how it works for me. And having had influenza before, I'll line up on day one to get the vaccine every year. And I think I had my vaccine this year on the 26th of April, so I missed by one day. So that it's the best time of year is really the beginning of prior to the onset of winter, and when the government has told us which is the right vaccine for this year and which is the right vaccine for which age group. I'll throw to Christian's got more expertise on this than me, and you've got a second question. I better give him a chance to answer the second question. Thank you.
Thanks, Don. It's a good question, when to get the flu shot over here, because people think, should I get it later? Should I get it earlier? But Don's kind of right in that you want to have the flu vax before there's flu around. And I can tell you there's a lot of flu around at the moment. So if you haven't had your flu vax, now's a good time to get your flu vax, basically. Don, what Don was getting at is every year the flu vaccine's updated to try and guess what predominant strains of the flu will be around, because there's lots of different types of flu strains and they change every year. And so far, the information I've got this year is that the flu vaccine is actually very well matched to the circulating strains of flu in the Southern Hemisphere this year. So the flu vaccine is hopefully going to be a useful flu this year, vaccine this year. So it's a good time to get it, is now basically at the start of winter, and especially while we've got flu floating around. There's no point delaying, is what I'd say. In terms of which age group of people are most at risk of getting flu, many people are reluctant getting flu vaccine, thinking they get flu after getting the vaccine. Why is that? You don't get flu from getting the vaccine per se, because all the vaccine contains is basically a few proteins or bits of the virus, enough to prime the immune system. So that means allow the immune system to recognise it when it sees those bits in the future, but it's not enough to give you the virus. What sometimes happens after the flu shot is you can get a bit of a muscle ache or pain at the site of the injection, and some people can get some chills or shakes after the flu and the flu shot in the day or two following. And that's actually your immune system kicking into gear because it's recognised those proteins. So it's actually the immune system doing what it should be doing. It can make you feel lousy for 24 hours admittedly, but it's far better than actually getting the flu. As you'll see, people in the healthcare service are telling you, having looked after people with flu, and people who have had the flu will tell you, as Don has a little bit earlier on. In terms of which age group of people are more at risk of getting the flu, it's a bit variable, but usually it's groups of people that hang out together or move around a lot in the community. So that includes children at schools who then take it home to their parents, just like it's happened with COVID. It includes childcare centres, it includes aged care centres, it includes people who are in the working age groups. Those people aren't necessarily the most at risk of getting the serious consequences, apart from the kids and the elderly. Although, as Don said, anyone can be unlucky enough to get very sick from flu, but people moving around the community are more likely to pick it up and can take it home to those vulnerable people. So that's why we try and encourage flu vaccination in everyone, to protect the vulnerable at the extremes of age, and also those that are most likely to move around the community and spread it to others.
Thanks, Christian. We've got a question here for Jane. Jane, can kids, and this is from Chrysanthi, thanks Chrysanthi, can kids access the GP respiratory clinic services?
Yep, sure, Don. I was just about to type that in, but thanks for the opportunity to say yes. Kids can come as well. We're ready to see everybody.
Yep. And Jane, those services operating 7 days a week?
That's right, during the day on weekends and in the afternoon and evening during the week.
Yep. Thank you. Now, Hilaire's posed a couple of great questions in the chat. Thanks, Hilaire. So the first one, and it probably comes back to either Don or Christian. What is the correct time frame to get the booster, being the 4th dose, for someone who's caught COVID? Is it 3 months or 4 months after having contracted COVID?
That one's for Christian.
Yeah, so we tried to be simplified in terms of the public health advice. 3 months is probably not unreasonable. When you get COVID, it acts like a little bit of a booster to your immune system as well. Ironically, it's probably not as good as the vaccine. And therefore, there's a bit of an argument. There's two arguments. One, do you get your booster straight after you've had COVID? Because there's some evidence to suggest that supercharges the immune response and gives you protection. But on the flip side, we know you get some protection for 1 to 2 months, maybe even up to 3 months after getting COVID. So if you then go get your booster 3 months after you've had COVID, and that gives you another 3 months of protection, you can see how that would give you 6 months of good protection. So there's a couple of different arguments. I think if you're eligible, in that you're in the age group or you've got the immunocompromised things, even if you had COVID, once you're feeling better and recovered, go get your booster is probably the short answer.
Yeah. Well, Christian, that leads to the next question from Hilaire. Can you get both COVID and flu vaccinations at the same time?
Absolutely. The immune system can walk and chew gum. I think that's the saying. I always get it wrong. But the immune system is designed to see multiple infections or multiple insults at the same time, and can certainly deal with two different little infections. So there's no problem. That said, if you've got a respiratory illness or unwell, it's best to recover from that and then get the vaccine afterwards, because it just to make sure that the immune system can focus on the vaccine, so to speak. But 2 different vaccines at a time, no problem at all.
Yep. And everyone out there, you know you can go and get your vaccines at DPV Health's vaccination centre at the Hube Global Learning Centre, 1093 Pascoe Vale Road, Broadmeadows. Now, I'm just going to throw back to Jamel, who's had their hand up for quite a while. And we couldn't get you, Jamel, but are you there? Did you want to ask a question? Look, I've no doubt Jamel's probably rushed off to one of our GP respiratory clinics. Everyone, before we close tonight, let's see if we've got any last questions. We've had a lot of great feedback in the chat. Is there anything anyone else wanted to raise before we close tonight? All right, look, on behalf of DPV Health, I would like to extend our great thanks to our wonderful friends and industry experts, Dr. Christian Porter from the Northeast Public Health Unit, Dr. Don Campbell from Northern Health, and our very own wonderful Jerry Canaway, Chief Operations Officer at DPV Health. I'd also like to extend our great thanks to all of the representatives from DPV Health's Community Engagement Framework. Thank you for getting this important message out to your communities and for the time and expertise and goodwill you lend to DPV Health. Everyone have a lovely night, and we look forward to seeing you soon. Stay in good health. Thank you.